नमस्ते। आप सबका स्वागत है आज के बहुत ही स्पेशल कॉन्वर्जेशन में। हमारे साथ हैं डॉक्टर साहब और हम रहेंगे साथ में, मैं और डॉक्टर साहब रहेंगे। और इस पूरे कॉन्वर्जेशन में हम डिस्कस करेंगे कि हमारी न्यू मदर्स कैसे अपनी केयर करें अपने न्यूबॉर्न बेबी का, एक इन्फेंट का। तो मेरा नाम अभिलाषा सिंह है। मैं आर्ट ऑफ लिविंग की एक फैकल्टी हूँ। मैं हैप्पीनेस प्रोग्राम, श्री श्री योगा, लेमूरियन योगा, वेलनेस प्रोग्राम, ये सब कोर्सेज लेती हूँ। इसके अलावा मैं बाय प्रोफेशन इलेक्ट्रिकल इंजीनियर हूँ और एक पब्लिक सेक्टर यूनिट में एज अ सीनियर मैनेजर काम करती हूँ। मेरे साथ हैं डॉक्टर सुजय। ये बहुत ही सीनियर डॉक्टर हैं। इनका एक बहुत ही इलेबोरेट इंट्रोडक्शन है, पर मैं एक छोटे से ही संक्षिप्त तरीके से इनका इंट्रोडक्शन दूंगी। अ वेरी शॉर्ट इंट्रोडक्शन। Dr. Sujay has nearly 29 years of experience in pediatrics and neonatology. He completed his post-graduation in pediatrics and neonatology from Bangalore Medical College in 1999. He worked in the Department of Pediatrics and Neonatology as a lecturer at St. John's Medical College Hospital, Bangalore, after his post-graduation for about 3 years. He then traveled to the United Kingdom for further training in the field of pediatrics and neonatology. He worked in UK for about 10 years, and his last job placement was at Northumbria Healthcare NHS Foundation Trust as a consultant. He specialized in neonatology, taking care of babies in the first month of their life, pediatric gastroenterology, nutrition, and breastfeeding. He has worked as consultant neonatologist at various tertiary level NICU in UAE since October 2014. He is currently working at Sheikh Khalif General Hospital, Kuwait, UAE from the last 2 years. He has been a speaker at various national and international pediatric conferences and has more than half a dozen publications in various index journals. He will take up any question related to newborn baby care, feeding, growth, and development. So, a very warm welcome to you, Dr. Saab.
Thank you.
So many people are waiting, eagerly waiting to be guided.
Yeah,
so
sure.
It is very rightly said, na? It is said that when a child is born, a mother is born. तो जो एक मदर की, न्यू मदर की जो एक ये ब्यूटीफुल ट्रांसफॉर्मेटिव जर्नी है, इसकी शुरुआत में कुछ तो चैलेंजेस भी होते हैं। तो आज जो हम आपके साथ में जो कॉन्वर्जेशन करेंगे, इसमें आपके माध्यम से इन सभी न्यू मदर्स को एक गाइडेंस मिलेगी, जिससे उनको अवेयरनेस होगा कि एग्जैक्टली कैसे एक न्यू बॉर्न का टेक केयर करना है। ओके, so shall I start with the questions?
Yes.
Okay, sir. So what are the basic needs of a newborn baby and how should a mother take care of it?
Very good evening to everybody here. And first of all, at the outset, I would like to thank Abhilasha ji for giving me this introduction, what she told, and also thank Tripurari sir ji for giving me this platform to share my thoughts or some sort of a knowledge which will definitely be useful to you and your friends and family members. With that intention in my mind, I would like to tell whatever I know, and if you have any questions at the end, I can answer some of them also. Coming to neonatology field, neonate means it is a baby who is newly born and who is less than 1 month. Normally we take 28 days, normally less than 28 days. See, when we take care of newborn babies, they are not like miniature adults. Many people think, oh, baby is half the adult, so it's like treating the adult in a halfway. It is not exactly so. They have their own requirement, own necessity, and the approach is entirely different in comparison to taking care of an adult or even an older child. So when a baby is born, usually when baby is born, usually they are full term. Full term means usually after 9 months. Normally we take as 40 weeks pregnancy and 40 weeks gestation. When they are born, the most important thing for them is milk, feeding. And when they are born, they come out crying. That when the baby cries, we are happy. Because most parents crying is not sounds, it is very not a pleasant thing. But when at the time of birth, baby crying is a very important event. If the baby doesn't cry, everybody should be worried. So when baby cries, baby comes out, the first thing is the baby needs milk. See, adults, we eat or drink 2 times, 3 times, or 4 times a day. But babies, small babies, they need more frequently, like every 2 to 3 hours feeds. The most important thing what they need is mother's breast milk. Okay, and this has to be started immediately after birth. What they recommend is after the baby is born, within 1 hour, initiate the first breastfeeding. So once the baby gets the first feed, mother and baby will bond to each other. They sleep well, and mother should get ready for the next feed, usually after 2 to 3 hours. See, the basic needs of a newborn baby is the main thing is the feeding and sleep. They don't do anything more. They feed, they sleep. When babies sleep, or even any adult sleep, they grow, because they say that when the baby sleeps, the growth hormone is released from the brain. So growth is required for the baby. They need to grow, they need to put on weight. So for that, they need to feed and they need to sleep. So the main necessity for a newborn baby after birth is the breast milk and sleep, and taking care of the baby basic needs. With the baby, when the baby passes urine, stool, the baby has to be cleaned, and baby will feel comfortable. The mother has to feed her again. The baby sometimes needs every 1.5 to 2 hours feeding, sometimes 2 to 3 hours feeding. But maybe in the next subsequent questions I can answer them. But the main necessity is feeding, growing, and sleep. And we have to leave mother and baby together for some time. It's a new setup, new bonding which will evolve with time, and they need a lot of support. So with this, I can go to the next question.
डॉक्टर साहब ना, ऐसा देखा गया है जब भी बच्चे थोड़े से भी बीमार होते हैं तो पेरेंट्स बहुत ही वरिड हो जाते हैं, स्पेशली मदर, और बस भागते हैं डॉक्टर के पास. तो what are the common illnesses in a newborn baby, and how can we recognize it? And the other thing, see, are there any specific medicines that we should keep at home handy so we can administer ourselves?
Okay. Common illnesses in newborn babies. Newborn baby problems, if at all, if it comes, usually they are very non-specific. See, unlike adults, if you have a sore throat, fever, cough, then you think there is something in the throat, pharyngitis, you go and treat it. But newborn babies cannot speak for themselves. Correct. So it is very non-specific. Sometimes, as we know that if fever comes means infection, many times in infection, fever will not come for newborn babies. Sometimes the baby will be feeding very well, and within 1 day, 2 days, if at all, if any problem comes, the first thing is the feeding will be affected. The baby will not be active. The baby will not be sucking properly from the mother's breast. So they are very, very non-specific. Sometimes there may be more vomiting, sometimes diarrhea, sometimes fever. Fever is very rare in newborn babies to say as a problem. Sometimes the temperature goes low, not high, because sometimes the basic temperature for a newborn baby is 36.5 to 37.5 degrees Celsius. This is a normal baby temperature which we should maintain. If the temperature goes low, below 36.5 for no reason, then definitely you should be worried. Or if the temperature goes more than 37.5, definitely also we need to be worried. And I will say, because the symptoms are very non-specific in babies, I will strongly recommend to all parents and caregivers not to treat their newborn babies on their own. At least go to some health center to get proper assessment, proper advice. Because if you're so old child or adult, if you have fever today, today I will take some paracetamol and we will see tomorrow. But that is not the case in newborn babies. Sometimes they deteriorate very fast in newborn babies. Sometimes you don't know. There could be just because of the environmental temperature, the baby may be having some fever. So you never know. So my suggestion is, because it is very non-specific, for parents to understand what exactly is a problem will be difficult. My suggestion is not to treat themselves. Go to the nearby health center to get the baby checked up.
Right,
And
sir.
regarding the second part of the question which you asked me is that, do we have any kit which we can keep? There is no such kits for newborn babies. If you are worried, it's always safer option to go and show to the doctor once. But basic medicines like paracetamol drops, or sometimes because the nose is the nasal passage for babies is always small, they're obligatory nasal breathers, because if they close the mouth, if the nose is blocked, they feel difficulty to breathe. So sometimes we suggest to use some saline, like salt water drops, like what we call saline nasal drops. Those can be kept at home. And for example, paracetamol also can be kept at home. But if they are worried, my strong suggestion is not to treat their babies on their own. Better to check once and then take proper recommendation and then go ahead.
Really an eye opener. तो डॉक्टर साहब, जब एक बच्चे का जन्म होता है तो उसकी जो नाल है, अम्बिलिकल कॉर्ड, उसको कट किया जाता है, फिर वो कुछ समय तक रहती है, तो उस दौरान ड्यूरिंग दैट पीरियड हमें क्या ध्यान रखना चाहिए? हाउ शुड वी क्लीन एंड टेक केयर ऑफ द अम्बिलिकल कॉर्ड स्टम्प?
If you ask people about 5 years back, 10 years back, or if you go throughout India, different parts of India have different customs and traditions how to take care of the cord. It comes in their traditions. But as a doctor, now they say there is nothing required specifically to take care of the cord. You should keep it clean and dry. Umbilical cord usually falls by about 10 days to 2 weeks. 10 to 14 days, usually they fall. Sometimes 1 week, sometimes 2 weeks, sometimes goes beyond 3 weeks. If it is going beyond 3 to 4 weeks, we will be worried also. It should fall by 2 weeks, usually 2 to 3 weeks. Beyond 3 to 4 weeks, if it is not falling, then we think of immunodeficiency, sometimes immunity related issues also we think. But that is very rare. Most of the time, they fall by 10 to 14 days. You don't need to do anything specific, not even putting any powder, not even cleaning the umbilical stump with any alcohol. Sometimes at the time when it is getting separated, you will get some pus discharge or some bloody discharge also. That you can just clean it with just lukewarm water and clean water you can clean, or sometimes you can use some alcohol wipes just to clean that area. But on a routine day-to-day basis, there is nothing specific required for taking care of the umbilical cord. And my suggestion is always when they put the nappy, the pamper, what they put, it's always better not to cover the umbilical cord. Let the pamper be below the cord, so it should be exposed to air. As it is exposed to air, the chances of any infection and it will not be there, and the chances of falling early is also will be there. So not to cover the cord with any pamper, just keep it clean and dry. That's the basic message I would like to give. And if you're really worried, sometimes if you're thinking of any infection, if too much pus discharge, sometimes too much bleeding, definitely show to a doctor. Sometimes there'll be surrounding redness of the skin where there is a stump. That is suggestive sometimes of infection. Definitely go to a doctor. But as a general advice, nothing much is required. Keep it clean and dry. It will fall on its own.
Okay, sir. तो नेक्स्ट क्वेश्चन इज कि पूरे दिन भर में जैसे एक टेम्परेचर वेरिएशंस होता है, दिन में वार्म होता है, रात को थोड़ा सा कूल होता है, या हम एसी ऑन कर लेते हैं तो ठंडा हो जाता है टेम्परेचर. Now to keep a baby comfortable and safe during different temperatures of the day and season, how should a baby be dressed up?
Okay, as I told you in my previous answer, the baby temperature always should be maintained between 36.5 to 37.5 degrees Celsius. This is the optimum baby temperature. Sometimes because where they live, summer areas or colder areas or AC or heat, so this sometimes can vary the temperature of the babies. Normally, what I suggest is you keep the room temperature of the babies around 18 to 22 degrees. Again, this can vary at different parts of India, for example, different places because of the environmental temperature also. As a general advice, 2 layers of cotton clothes is enough over the body. And preferably use only cotton clothes, not to use any synthetic wool clothes. If they are at home, let them use 2 layers of cotton clothes, and not even a head cap is required, even if they're at home. If they're going out, then probably a head cap, a socks, and mittens also may be required. But as a general dressing code, 2 layers of cotton clothes is enough. 80 and always keep the temperature, this range, 36.5 to 37.5. If they're worried about the baby temperature or if the baby is feeling hot or feeling cold to touch, let them check the baby temperature. Let them buy one basic thermometer. Sometimes you can use the digital thermometer, what you get. You can keep it in the armpit for about 2 minutes, check the temperature. Or nowadays you get infrared thermometers which will check the temperature in the ears. Any of them, basic thermometer is enough, digital one. They can check if they're worried the temperature is more or low, but maintain this temperature. 2 layers of cotton clothes is enough.
In the same question, sir, it is generally like in India, what we do, we touch the feet of the baby to see if it is warm or not. Is that the right way? If we do not use a thermometer, can we just by touching the feet, can we see the
Touching
temperature?
the feet is very difficult to assess the exact body temperature. Again, it depends on the environmental temperature. If the baby is in an environment where it is cold or with AC, sometimes your feet may feel cold. Okay. Or if the baby is put in a very warm environment and baby is put the socks, then again it may feel warm. So if you are in doubt, I will say that is not a very reliable method of assessing temperature. Just check a basic digital thermometer, use a digital thermometer to check the temperature. And if they are worried, if this is associated with that baby's activity is less or baby is not feeding properly, then it could be a sign of infection. Definitely approach healthcare setting for the proper assessment.
Right, sir. तो अब जो मेरा नेक्स्ट क्वेश्चन है वो मदर्स के साथ द मोस्ट कॉमन क्वेश्चन, न्यू बॉर्न बेबी के स्लीपिंग पैटर्न्स. बेबीज जनरली उनका एकदम इरेगुलर स्लीपिंग शेड्यूल होता है. So sir, what can you please give some insights on this, the sleeping patterns of a baby newborn?
Okay. See, as I told you, baby needs to grow. Adults are already grown. They only eat, drink to maintain their basal metabolic and basal activity. But baby has to grow. Their brain has to grow. They have to become lengthy. The weight has to come up. So for all this, they need to sleep more. As I told you, the more you sleep, you will get more growth hormone released from the brain. So they sleep more. Almost a newborn baby will sleep almost 16 to 18 hours in a day. That's almost the whole day the baby will be sleeping. As I told you in my first answer, they only wake up for feeds. Or if the baby has passed urine and stools, the baby will feel uncomfortable, and the baby will wake up. So the baby sleeps most of the time, and mother has to feed approximately. As I told you, I will always recommend and encourage all mothers to give mother's own milk, that is breast milk, that is the best. I will tell you the advantages later. But in order to give regular feeding, she has to feed at least 10 to 12 times per day, every 2 to 3 hours. So they will be sleeping, and most of the time, initial few weeks of life after birth, the babies are awake more during the night time and they sleep more during the day. This is a normal pattern. This pattern, the circadian rhythm, will change after 3 to 4 weeks. Till that time, babies will be a little bit more active during the night and more sleepy during the day. So that's why people say that mother and baby should be kept alone with lot of support to be given, because mother also needs rest after delivery. So my suggestion is, because in order to feed regularly throughout the day, every 2 to 3 hours, the mother also should take rest along with the baby whenever baby sleeps. So when the baby wakes up, she has to wake up, give feeding, or if she's really tired, she can express some breast milk and ask somebody to help baby to be fed. But the sleeping pattern is 16 to 18 hours per day. It will gradually reduce. They sleep more during the daytime. They will be awake more during the night time. And mother also have to follow the same sleeping pattern of the baby. So she will not get tired. And at the same time, she will also be able to feed breastfeeding regularly 10 to 12 times per day, or at least 8 to 10 times per day. So this is the basic sleeping pattern. Because many parents ask me, the babies are always awake in the night time, what to do? I will say, just wait. Automatically, the rhythm will change within a couple of weeks. Just follow the same pattern. Mother also to do the same thing. That's why the people say not too many visitors for mother and baby when the baby is delivered, because mother also needs rest. So let her take rest along with the baby whenever baby sleeps, and wake up for breastfeeding whenever the baby wakes up.
वेरी राइट सर। हाँ, जैसा हम देख रहे हैं, जैसा आप बता रहे हैं, ऐसा ही ट्रेडिशन में भी था, बट समहाउ दीज डेज अब ये चीज फॉलो नहीं की जा रही है, विजिटर्स भी आ रहे हैं और ये,
हाँ,
तो यू वेरी राइटली गाइडेड अस कि दिस शुड बी स्ट्रिक्टली फॉलोड।
yes.
बेनिफिट फॉर मदर एंड
Other
चाइल्ड
thing
बोथ।
is, I will suggest for visitors, too many visitors to be avoided, because too many visitors, again, baby is a newborn baby. The immunity for the baby will be less. You have to protect the baby. It's like mother protecting the baby in the womb, which was before birth. After baby is born, mother has to take care of the baby. Their immunity will be less. Too many visitors or visitors having cough, cold, better to avoid in the first few weeks, because mother and baby should take rest. Again, the babies can catch infection also. So better to avoid visitors in the first few weeks for seeing the mother or baby, just for the best interest of them.
सर हमने बहुत देखा है दादी नानियों को, वो क्या करते हैं, छोटे बच्चे को अब उल्टा लिटा देते हैं पेट के बल, ऑन द स्टमक, एंड दे लीव द चाइल्ड फॉर सम टाइम टू प्ले ऑन इट्स ओन. So I want to ask you, how much should be this tummy time, and when should it be started?
Okay, tummy time is a very good concept, but it should be done only when the baby is awake and parents should supervise. Now, when the baby sleeps, we recommend baby to be back to sleep. Back to sleep matlab baby should be supine. The back should be to the bed. We should never allow the baby sleep on the tummy when the baby is sleeping, because there are a lot of literature which says that chances of baby dying, cot death, or SIDS, what we call SIDS means sudden infant death syndrome, or cot death. Sometimes there are more in babies who are prone or babies who are sleeping on their tummy. So the first basic message is never allow the baby to sleep on the tummy. When the baby is awake, say baby is just woken up for the feed, now baby is active, so baby is woken up for the urine and stool, the baby is very active, then you can keep the baby on the tummy for a couple of minutes, but parents should supervise. And when to start, you can start as soon as possible after birth. Within first week also, you can gradually start 2 to 3 minutes, 3 to 5 minutes, and gradually increase. By about 6 weeks to 8 weeks, the baby can sleep for about 15 to 20 minutes, like a tummy time. Tummy time means they can do it like 2 to 3 times per day. 2 to 3 times per day to start with couple of minutes, then gradually increase the number of minutes as tolerated. See, we cannot give all babies the same. Each baby is different. If the babies want to sleep, then they can reduce the tummy time. They can gradually increase the tummy time. Tummy time is very important. It is also very useful also. Sometimes if you see the skull, the scalp is very soft in babies. If the baby is always sleeping on the back, the skull becomes flat on one side. You may not get a round shape of the head. So that's why people say tummy time means the baby will be more lifting the head without the head on the bed. That will avoid the flatness, and also it will give strength to the shoulders, trunk for proper development also, like head control, rolling over of the babies as part of the development. So tummy time is also good. And parents can interact with the baby more when the baby is on the tummy. They can sit or come to the front and they can talk to them, listen to some music, sing some music, or sing some song. They can actually interact much with the baby when the baby is in the tummy time. So these are all the advantages of tummy time. But when the baby wants to sleep, it should be back to sleep, not on the tummy. That's a basic information, a basic caution I would like to say. Tummy time is recommended.
Very nice. So you have made this tummy time so interesting. अभी ऐसा लग रहा है ऐसा तो बच्चे के साथ enjoy करना चाहिए.
No, it is very enjoyable thing to play
Yeah.
with the baby, especially when the baby is laughing. You interact with the baby makes some cooing sounds, and parents come in front. That is how the bonding develops. That is how the development happens for babies. More interaction, more developmental stimulation should be there for babies. And this is one of the time where they can do this tummy time.
Very beautiful. तो नेक्स्ट क्वेश्चन इज कि ऐसा बहुत देखा गया, कुछ बच्चे ना बहुत ज्यादा रोते हैं, बहुत देर तक रोते रहते हैं या पूरी रात रोते हैं, और ऐसे में मदर के लिए तो वो अनबेरेबल हो जाता है एंड द होल फैमिली गेट्स अपसेट. तो व्हाट इज द बेस्ट वे टू काम डाउन सच अ फसी और colicky baby?
See, colicky baby is most of the babies will have colic problem. Okay. The colic problem usually starts around after 2 weeks, 10 days to 2 weeks. It goes up to 6 to 8 weeks, and it will be staying for about 3 to 4 months, 3 months. So it peaks around 4 to 6 weeks of age. Means the crying part will be more. This is exact reason for colic nobody knows. Some babies cry more, some babies cry less.
Right.
Okay, that also you might have. Some babies are very calm. The first 2 weeks, first 1 week, the babies are very quiet, no crying. Parents are so happy.
Yeah.
Because the baby feeds, the baby sleeps. That's all. After 2 to 3 weeks, some babies start this crying episodes, especially more in the late evening time, night time. They follow a particular pattern, like same time of the day, evening time, night time, they start crying. And some babies are consolable, some babies are not at all consolable. Very difficult.
Yes.
Exact reason, nobody knows. I also don't know. But see, you have to think about the basic things first. Like the baby may be crying for pamper change, urine baby might have passed, baby is discomfort, uncomfortable. So change the pamper, do a lot of cuddling, maybe try for a breastfeeding, baby may need, or just skin to skin with the mother. In breastfeeding, we call what is called skin to skin, called as KMC. I don't know whether you all have heard about KMC. KMC is kangaroo mother care. Kangaroo, you know, the baby kangaroo in the pouch of the mother.
Yes.
Like that, baby and mother should be skin to skin against the mother's chest. So the baby will feel very warm, very comfortable, and that bonding will reduce the crying. That also she can try. Sometimes, see, there are a lot of medicines also which has come, anti-colic medicines. Sometimes we give Simethicone, that ingredient, that medicine, but there is no much evidence that will work. Some babies it may work, some babies it will not work, but there is no much evidence. It is the basic treatment is education and reassurance of the parents. See, if the parents are very confident about what exactly is happening for their baby, half the treatment is done. You understand what I'm trying to tell?
Right.
See, there is no specific medicine. You give this medicine, the baby will stop crying. You have to see the basic things. Maybe the baby is very warm, reduce the temperature of the room. Or baby is very cold, keep the baby warm. Sometimes nose could be blocked. Baby is so much irritable, the baby may be crying. Use some saline drops, 1 drop, 1 drop. Change the pamper, cuddle the baby, maybe give breastfeeding. Talk to or listen to some light music. Sometimes I tell them, but some will work, some will not work. Sometimes this white noise, have you heard of white noise? White noise is something, a similar rhythmic noise, like a washing machine noise. That is called as a white noise. So that noise, sometimes babies will stop crying, or mother talking or singing, cuddling, breastfeeding, skin to skin, as I told you, KMC, or sometimes reducing the temperature of the room. Check the baby temperature. Baby is very warm. Some parents want to keep the baby very warm. They will put 2 layers of clothes plus 1 blanket over it. Baby will become very warm and baby will become discomfort and baby starts to cry. So these are the basic things we need to rule out. And if all these are ruled out, sometimes continuous crying in an unexpected time, suddenly you may think of infection also. So you may need to go to approach a doctor also. If doctor sees and says, no, this is just colic, that pattern may come in the next few days or weeks. So the basic message, what I'm trying to tell is educating the parents that colic is a problem which can come. It can come in very severe fashion also. It needs reassurance, and just that confidence in the parents itself will reduce the anxiety in the parents. That reduction in anxiety will calm the baby also. There is this one. And sometimes I've seen, there is no much evidence, but mother's diet. Sometimes if she is breastfeeding, sometimes if she eats something very spicy, or sometimes she drinks some soft drinks, that same gas, the same features may be seen if she is breastfeeding. But again, there is no much evidence, but I've seen mother's diet also sometimes plays a role in this, but there is no specific reason. You cannot pinpoint and say this is the reason for crying, because crying is normal for babies. Some babies cry more, some babies more. Just give education and reassurance is the main approach in the management of crying babies. But you have to make sure you approach the doctor at the right time. If they're really concerned, one time she can go. And if the doctor says, no, this is just colic problem, you have to manage, just give Just follow this advice, what I've told you. The main thing is generating or giving more boost to the parents, confidence in the parents, and reducing the anxiety in the parents. I've seen so many times the parents become so much anxious that anxiety is seen in the babies also. They cry more.
Right.
So educate the parents, reassure them what is the course of this colic problem. Once they understand, they will be in a better position to manage the babies.
Right. The parents have to be aware, educated, and creative. Then
Yes,
this can be
yes.
Very nice.
Otherwise, if they are not educated and they will just go from one doctor to another, one hospital to another, and they may think of so many conditions. Again, the same problem is a colic problem. But we have to rule out infections and we have to rule out the basics, what I've told you.
This session is really going to be very, very helpful for the parents to build up their confidence and awareness both. And creativity too. You've given us so many ideas.
Yeah, you can listen to some music, light music. Mothers can sing, father can sing, or some light, soothing music for the babies. Not a very jarring sound, but very musical, some instruments. All this can help. I'm not telling that will help. It may help, it may not help, but you have to try.
One has to try
yes.
various.
Yes. Sometimes I've seen my daughter, when she was young, she has too much colicky. And what we used to do is in the night, 2 o'clock, 2 a.m., 1 a.m., we have to take her in a car drive just outside. She goes in the car drive, and once she comes back, she sleeps. She just needs that car drive. Or just go out in the balcony in the house. That little bit of breeze or fresh air will calm the baby. Again, there is no specific thing. Some babies, they have to become creative. But main thing is education and reassuring them. That's very important.
Very nice, sir.
Because as a pediatrician, you are not treating only the baby. We are treating the parents also. Once the parents are treated, half treatment is already done for the babies.
Absolutely right, sir. I can relate with myself. When I was a young mother, I needed treatment more than my child.
Yes, you have to get the confidence of the parents. You have to boost their confidence, reduce their anxiety. That is one of the role of a pediatrician.
Now, related to this question, I was about to ask it later on, but I'll ask it right now only. Are there any specific foods which are to be avoided? Like you said, aerated drinks and spicy food. Any other food also a feeding mother should avoid?
There is no such thing that mother has to avoid any food. She can take any food, depends on their traditions, because if you go from North India, South India, there will be different traditions followed in their family. I will suggest follow them, but everything in moderation. Home food, everything in moderation, freshly prepared home food, that's enough. But again, too much spicy, too much salty, avoid. Definitely, I will not, as a doctor, nobody will advise to drink soft drinks. I'm just telling you for colicky problem. But generally, there is no such restriction in mother's diet for anything for breastfeeding after delivery. But just follow their tradition, whatever they're available in the family, but everything in moderation.
Right.
Nothing.
Moderate.
Yes. Don't take anything more, don't take anything less. Just be moderate. Spicy, optimum, little spicy only, not too much spicy also. Because mother also should get proper diet. See, many traditions, if you see mothers, they have their own diet after delivery. They follow so many traditions. But there is no much evidence, and as a doctor, we never recommend to be restrictive diet for the mother, because she has to give milk for the baby. Her nutrition also should be very good in order to take care of the baby and also to get more milk. So there's no restriction specific, anything like that. But better to avoid outside food, very spicy, soft drinks, preferably to eat freshly prepared food, everything in moderation. Moderation is a key.
Very right, sir. So one question related to a preterm, premature baby. How should the mother feed a premature baby? A mother's milk, formula milk, or a combination of both?
No. Whether a baby is born term, after 9 months, or preterm, mother's milk is the best. Okay? But when you say preterm, it depends on how preterm the baby is. Say, when we say, normally babies are born, when you say term babies, any baby born after 37 weeks, we call as term. Anything baby less than 37 weeks, we call preterm. If a baby is born 35, 34, 36 weeks, mother can still directly feed the baby with her own milk. But any baby born less than that, the baby will need help. Mother also will need help because mother has to suck, swallow, and breathe. See, when we eat and drink, we also simultaneously breathe. Right. So this sucking, swallowing, and breathing coordination should be there. For extreme premature babies or preterm babies, this coordination, it will take time to mature and for it to develop. Till that time, they will need help. What help? Mothers can be advised to express breast milk using a breast pump or hand expression, and that milk can be given by a cup or a syringe they can use. Or extreme premature babies in the NICU in the hospital, we put a tube into the stomach and feed the breast milk, mother's brain. As the baby grows, as this sucking, swallowing coordination improves, we allow the mothers to start direct breastfeeding. Very rarely, some mothers' milk may be less. That time, we suggest formula feeds for the growth for the babies. But most mothers, the hormones and the nature is so good that all the mothers will get enough breast milk for the babies. So if you take proper if you give proper advice and take care of the mothers from the antenatal period. See, the breastfeeding, even though it starts after birth, the preparation should start before delivery. Third trimester, the mother should be advised and encouraged to feed the baby breast milk after birth. So that proper checking of the breast, if there's any problem in the breast. So the preparation starts before delivery only. So if you give proper help to the mothers, even a preterm mother baby and also a term, she can feed breast milk only. Very rarely, in some instances, some problems may be there for the mothers where we may need to use formula milk. But my general advice is both term babies, preterm babies, mother's milk is the best.
So it is said sometimes that when a mother feels the supply of the milk is less, if she keeps on taking the baby near the breast again and again, will the supply increase?
Yes. Yes. Definitely it will increase. That is what I was about to tell you now. For breast milk to produce, there are two hormones required. One is prolactin, one is oxytocin. Maybe you may not be knowing about this. This is from the brain, pituitary gland in the brain. Prolactin is to increase the milk production, and oxytocin is actually to eject the milk out of the breast. Means it will pump the pump. So for example, oxytocin is also called as bonding hormone or love hormone. What happens if mothers keep, that's what I was telling you previously, kangaroo mother care. When the baby and mother is kept skin to skin against the mother's chest, that bonding, that relaxation itself will produce a lot of oxytocin that will help the mother to get the milk out of the breast. It will increase the prolactin also. The previous feed, the mother, if she feeds more, she will get more milk. The more you empty the breast, she will get more milk. See, many questions come, I don't have much milk for the mothers. But I will say, did you empty the breast? Did you regularly feed the baby? That's why I told you initially, you have to feed at least 8 to 12 times per day. Means the more you empty the breast, the more milk will come. There is nothing, no other medicine required, no specific herbal medicines also required. The basic thing is, she feeds more number of times, her breast gets emptied, the more milk will come by nature, by those hormones. So even for example, when you see mother is sitting here and the baby is crying in the room. As she cries, if mother, sometimes maybe mothers, experienced mothers, they might have experienced this, the milk comes out of the breast when the baby is crying next door or next room also.
True, sir.
And when the mother is feeding from one side of the breast, the milk will come out from the other side. See, the nature is so strong, it will protect both baby and the mother. So you don't need to use formula milk. Mother's own milk is enough. Proper advice and little education, little support has to be given to the mother. Definitely she can continue and sustain the breastfeeding. And before I stop this answer, I would like to tell mother has to feed her baby at least 6 months exclusive breastfeeding, and at least 2 years she has to continue breastfeeding. Means at 6 months we start something new food, like what we call as a weaning food. Like you start some rice ganji or ragi ganji in South India and all, they start ragi ganji. So that can be started after 6 months, but first 6 months, exclusive breastfeeding, and gradually weaning at 6 months, and she can continue breastfeeding until 2 years of age. So this is the recommended time frame until how long she has to breastfeed also. So with proper support to the mothers, she can really do good for the babies. And there's a lot of advantages of giving breast milk to the babies. Long-term IQ will be good. Long-term health problems are less. Mothers' health problems will be less. Chances of breast cancer, ovarian cancer are less. The postpartum bleeding, after delivery bleeding occurs for mothers, that also will reduce by exclusive breastfeeding. So there are a lot of advantages for both mother and babies. I will strongly recommend to give breastfeeding only, but she needs proper support. In some mothers are so experienced, second baby, third baby, they're so experienced. But first mothers, they need little bit support. And I will always say, breastfeeding advice is not only for the mother, it is for the whole family. Because if you say that mother, for example, somebody at home, they say, oh, you don't have much milk, baby is crying too much, give formula. The mother's confidence will go down. Her oxytocin will come down. Her prolactin may come down, and she will reduce the breast milk. So every member in the family, husband, the in-laws, the parents, everybody should say and support feeding for the mother, breastfeeding for the baby. So that will actually boost the moral confidence of the mother also. And it will help in sustainment of the breastfeeding.
Very, very informative, sir. So one more question comes up. When a baby is hungry, it gives various signals and signs. So how does a mother understand those signs, and at what frequency should she feed the baby, and how long should she feed the baby?
Okay, as I told you, baby needs about 8 to 12 times per day, every 2 to 3 hours feeding. The duration of feeding, there is no set specific duration for how long to feed. Some babies take 20-30 minutes, some babies take 4 to 5 minutes. Initial phases, initial first week, babies take a longer time. But once mother gets more milk and baby is very active, it will just take within 4 or 5 minutes. The basic message is demand feeding. Demand means whenever baby wants, mother has to feed. How long? As long as the baby wants. So the baby will decide when to stop. That time you stop. The only thing is, for this to happen, mother and baby should be together. That's why we recommend rooming in. Rooming in means when mother is there, the same room the baby should be there. So when the baby cries, mother has to attend her baby cues and immediately start feeding. How long? Again, baby will decide. Duration, like how often? It's demand feeding. Sometimes baby may feed at 2 hours, sometimes may for 3 hours. But baby will decide. That's why demand feeding, and leave it to the baby how long the baby needs to be fed. This add rooming in. Rooming in will help to accomplish these two.
Very nice. Connected to this, initially sometimes a newborn baby is not able to latch on correctly. And sometimes baby also refuses to take the feed. What should be done in such a case?
See, that's why in the primary mothers, like the first baby, the mother is first time having a baby, she needs little support. So somebody in the family, or sometimes in the hospital where she goes, some of the nurses can help her, or in some hospitals there is lactation consultants. The main thing for the baby and mother for proper feeding is proper positioning of the mother. She has to be in a very relaxed, comfortable position. She has to have a footrest, pillow, comfortable, relaxed shoulders, spine should be straight, and baby should be properly held against the mother's chest. If you see in the breast, there is something called as a nipple and something called as an areola. The areola is the brownish part surrounding the nipple. Many times what happens, when the baby attaches to the breast, the baby attaches only to the nipple part and not to the areola part, which is the brownish part. If the baby attaches only to the nipple part, baby will not get milk when the baby sucks. The baby has to attach to the areolar part, means the baby has to come much more towards the breast. Once the baby holds the areola, then sucks, the baby will get milk, and the chances of biting or sore nipples, all this will be reduced. If she doesn't feed properly, mother sometimes can have engorgement in the breast. The milk will not come out because the baby is not properly latching on. That latching on, basic advice is the baby has to attach to the areolar part. The whole of the baby mouth should be along with the breast, and not to hold only the nipple part. That times baby will not get milk, baby will cry more, and mother's milk will be stored in the breast. It will cause engorgement. You might have heard mother's milk too much in the breast. That sometimes may cause infection in the breast tissue also. So proper attachment and latching on is very important for successful breastfeeding. Many mothers have seen without proper advice on latching on and attachment, they have failed in their breastfeeding. So they need little support. If there is a problem, definitely show to you somebody, either who is somebody in the family who is elder, who is experienced in that, or whenever they go to the health center, they can show to one of the nurses and properly feed one time there. So she will know how to hold, how to latch on. That knack, once mother gets, she will enjoy breastfeeding also.
True, sir. True. Very nice. And working mothers, they are the most worried mothers. So the major concern of working mothers is when they go out, how will they feed the baby? So can they store the milk, and can that milk be warmed?
Yes, I will tell some advice for the working mothers. See, as doctors, as parents, as caregivers, it's our responsibility that our babies, our newborn babies, they are very good citizens. They are healthy citizens also. For that, the most important foundation is one of the most important thing is breastfeeding. So as I told you, until 6 months, exclusive breastfeeding, until 2 years, recommended breastfeeding. So nowadays, parents, mothers are working. They may have very little leave during the delivery and maternity. So it all depends on how long they get the leave. As long as they are at home, let them continue exclusive breastfeeding. Once she knows that she has to start work in the next month, maybe 3 to 4 weeks before, she can start expressing breast milk. They can buy a breast pump, very ordinary breast pump is enough. So she can take breast pump. As she is feeding the baby, at least 3 times a day, she can express milk before 1 month of starting work. And she can store in the fridge. Okay, coming to storage in the fridge. How long to store? Just milk, if she is expressed today, she can store in the refrigerator for about 3 to 5 days, not more than that. So if she wants to store for a longer time, it has to be kept in the freezer compartment. I'll just tell you about the freezing compartment, how long to take. Normally, most of our houses will have fridge which has got inbuilt freezer also. At the top is a freezer and bottom is a refrigerator. Like that, if you have, you can keep it in the freezer for 2 weeks. If it is a separate freezer, you can keep up to 3 to 6 months. And there is a separate freezer, especially in the hospitals and all, they can store the breast milk even for 6 to 12 months also. But for all practical purpose, at home, you can keep it in the freezer for up to 2 weeks. So once she knows that she is going to work in the next month, she can start expressing milk at least 3 times a day along with the regular feeding. She can store in the refrigerator or in the freezer, and 2 days before she starts work, she can just do a trial that whatever stored in the refrigerator, she can feed with the help of a cup or a syringe. We normally advise avoid bottle feeding here. I'm not encouraging bottle feeding at all. I always say use a cup or a syringe, and they can take the milk from the fridge and she can feed at the same time when she's at work. Say, for example, she goes 8 to 4 for duty or 8 to 2. That time, 2 to 3 times, she can feed by a cup or a syringe from the stored express milk. Once she starts going to work, any other member in the family can feed the baby when in her absence. Before she goes to work, she can directly feed, and immediately when she comes back from work, she can feed the baby directly. But we should have facilities at her workplace. Every 2 to 3 hours for 10-15 minutes, she has to go in a separate room where she can express and store the milk and come and store in the fridge again. See, this facility has to be provided by the employers for the working mothers, especially if they are breastfeeding. Nowadays, that awareness has increased. Many places now, workplace, they have places for breast pumping and breastfeeding also. Even if you go to malls, cinema theaters, there are places where there is breastfeeding. Even railway stations, bus stations have places for breastfeeding. So everybody is getting aware. So that education part to the mothers that they can still continue exclusive breastfeeding even when they start working. This awareness, if it comes, and this proper education, what I've told you, how to prepare yourself before going to work and continue breastfeeding, will make a big advantage for the baby in future.
That's nice, sir. So can that milk be warmed also, heated also?
Once you take it out from the fridge, stored milk, if you have kept the milk in the freezer, you can bring it down to the refrigerator. That can be kept for 24 hours and it becomes thawed. Thawed, the freezing, the opposite of freezing is thawing. Means you have to warm the milk. Once you take it out from the refrigerator, you should not boil it. What you can do is take it in a bottle, whatever bottle you have, and keep that bottle in the basin or of warm water.
Yeah.
Okay, not to directly boil the milk. The milk which is kept in the bottle should be kept in a basin of warm water before feeding the baby. The milk should be at room temperature before feeding the baby. It should not be very hot. It should not be cold. Second, before feeding the baby, always put some milk on your dorsum of the hand. This is the dorsum of the hand, just to make sure it is not very hot, very cold. It should be lukewarm. So you should not boil. You should keep it in a basin of milk in a bottle, and that bottle should be kept in the basin once you remove the breast milk from the fridge.
Right. So all the questions are answered so elaborately and perfectly. We have a few questions from the viewers.
Audience, yeah.
Somebody is asking, if any child of 2 years old has enlarged liver, what should be the medications?
Enlarged liver, yes. See, enlarged liver has to be properly checked, properly assessed, properly evaluated to know what is the cause for the enlarged liver. We may need to do basic blood tests, blood count, liver function test, and maybe doing ultrasound scan of the abdomen before coming to a diagnosis. Once you know the diagnosis, then you know what is to be done. So whether we have to take proper history, properly evaluation has to be done. So unless you know what is the exact history, from how long is this problem, how is the child overall growth, development, you cannot answer completely this question. It has to be properly evaluated first.
One has to.
I think better to go to a pediatrician to be checked first.
Right, sir. So can you please throw some light on the jaundice in infants? Somebody's asking. Jaundice in infants.
We didn't touch upon jaundice. Jaundice is a very common problem which we see in newborn babies. When the baby is born full term, almost 6 out of 10 newborn babies will have jaundice. If they are born preterm, almost 8 out of 10 newborn babies will have jaundice. Jaundice is a very common problem. Sometimes it will become very high jaundice level. That is dangerous. Why it is dangerous? Because it can affect the hearing, and also sometimes it can affect the brain. It can affect their development for the child. That's why after baby is born, sometimes the jaundice can be high because of the discrepancy in the blood group of the mother and baby. Sometimes if mother is O blood group and baby is A, B, or AB, or mother is Rh negative blood group, and baby is positive blood group, the chances of jaundice will be high. Sometimes lack of feeding also, dehydration can also cause more jaundice. So jaundice has to be taken seriously. That is why after birth, the doctor recommends to come after few days for checkup. When the baby comes for checkup, we normally see the weight of the baby, how's the breastfeeding going on, and look for any evidence of jaundice. If the doctor suspects that clinically the baby has got jaundice, they will do a blood test to check the bilirubin levels. Bilirubin is a jaundice level. And if the jaundice level is high, we recommend treatment called phototherapy. Phototherapy is giving like artificial sunlight. Phototherapy for the babies to reduce the jaundice level. If the jaundice crosses a certain level, beyond a certain level, especially in premature babies, especially in a newborn baby, it can affect the brain and hearing. That's why importance of early recognition of jaundice and early treatment is essential to prevent this developmental issues later. So jaundice is quite common. Most babies will get jaundice, but most of them will be mild and they get better. But some babies only get more jaundice. That's why the importance of little bit, when we call for follow-up for newborn babies, we call little bit more frequently. every 2 to 3 days or within 1 week to come and check for the baby. Once the baby crosses 1 week, 10 days, the jaundice chances of going high is less. The first 7 to 10 days or 7 days is very important for assessment of jaundice. Jaundice is basically a yellowish discoloration of the skin. Sometimes because of the different skin color, you may not be able to properly assess the jaundice level just by looking at the baby. Sometimes you may need to do a blood test if you are in doubt to check the exact value of jaundice. Only when you know the exact value of jaundice, you can give appropriate treatment, which is phototherapy.
So one more question. Sir, my child is almost 2 years. Now he is having pus type discharge like dandruff on his back of the head from 5 months.
That could be pus type discharge. Maybe it is a dandruff like we sometimes call as.
Yeah. May I repeat this? Yes, almost. My child is almost 2 years now. He is having pus type discharge like dandruff on his back of the head since 5 months.
It could be some infection. Sometimes it may be related to fungal infection. Sometimes it could be seborrheic dermatitis, where there is a history of allergy in the family, dry skin, eczema that can be associated with this. This needs proper checking and proper treatment. I think this should get better. We have to rule out any dry skin or any allergy in the family in these situations. And sometimes we treat with antifungal treatment. So antifungus may be required. I think I cannot answer this question unless we see the child. It needs to be checked by the pediatrician for proper evaluation and treatment. But these are the possibilities which I am trying to tell.
So which pillow to use for a newborn baby to avoid flat head?
Which
pillow to be used for a newborn baby?
Normally, for a newborn baby, we don't advise pillows. As I told you, back to sleep, and the baby should be on a firm mattress without any pillow and without any cushiony stuff surrounding the baby. Okay, so we don't recommend any pillow for the baby. Sometimes, if you still want to use, sometimes what happens, a baby, one side, I told you, one side can become flat, one side will be more prominent. That's why tummy time is important. Second, the baby sometimes will sleep on one side. Some babies have a tendency to sleep on one side. Sometimes they sleep on right side or sometimes left side. There is no reason why they do that. Some babies do that. That time the baby head should be straight. If they sleep on this side will become flat. So sometimes in those situations, there is sometimes called as we should get a pillow where there is a center depression and the surrounding the head, there is a support. But when the baby sleeps, that part is still flat, but the surrounding the head, there is like a rim. U-shape, like a horseshoe shape pillow you get. You know, horseshoe shape, na? Get it in baby shops. That can be used. The only thing is that will prevent the baby to turn to either side, so avoid the flat. That can be used, but not like adults what we use pillows, we don't recommend. Newborn baby, flat, no need for pillow. And tummy time is recommended to prevent this.
I am 7 months pregnant. Can at the age of 43 normal delivery possible? For that, what should be done?
40?
43, age of 43. It's more of a gynec question.
She's 43 years old.
Yeah, she's 43 years old and 7 months pregnant as of now. So she's asking, is there any possibility for a normal delivery? And if there is a possibility, what should she do for that?
No, definitely there is a possibility. Is this her first child or what? No, you don't know.
She has not mentioned.
No, it can be done. Again, your gynecologist should answer this question properly after checking other things. But it can be done. It doesn't mean that if you are 43 years old, you should not have normal delivery. You can undergo a normal delivery. But some cases, again, it depends on the proper assessment. Your gynecologist should answer that question. But yes, it can be done.
If stress of mother affects breast milk secretion?
Which one? Sorry?
Does stress affects a mother's breast milk secretion?
Does what?
Yes, I think. Somebody is asking, does stress affects the volume of breast milk?
Yes. That's what I'm trying to tell. I told you, you have to treat the whole family. Mother should be given a lot of moral support. And she has to be encouraged for breastfeeding. The stress anxiety will reduce your oxytocin. Oxytocin is one of the hormone required for breast milk. I told you prolactin and oxytocin. These two hormones are very much required. And if there is a lot of stress, anxiety, your oxytocin will be less. It's a bonding hormone, love hormone. So stress definitely can reduce. That's why good moral support for the mothers is equally essential, which has to be given for all the mothers. Yes, stress can reduce.
The Sudarshan Kriya and meditation is very, very beneficial for each and every mother and all the family members.
Yes, correct. Exactly.
Sir, please share the diet chart for a 2-year-old baby.
Diet chart. Again, see, this is it is a very extensive answer. It is not it's a very non-specific thing. What I can answer for this is, you follow what your family follows. What you all eat at home, I always advise, eat along with the family. Don't individually make the child eat. When the child sits with the family, whatever the adults eat, the baby should be eating. And the baby should be having at least 4 times a day and 2 snacks, like two to 3 major meals and 2 snacks in between. But it should be all what is followed at home. Specific means you have to, it has to be, I cannot answer this question in this platform, but general advice is at least 3 times big meals and 2 snacks for a 2-year-old child.
Right, sir.
Again, how you accommodate that, it depends on what time you feed the baby, how is your family routine, what time you all eat at home. General advice is eat along with the family. The child will see what adults do and it will follow the same thing. So that is in a way, type of developing good habits. Okay, and don't allow the child to go on eating for a long time. Some children don't eat the whole food in the plate, and the mothers will continue to make them eat for 1 hour, 2 hours, 1.5 hours. I will say maximum 20-25 minutes. With that time, how much ever the child eats, let the child eat. Then take away the plate. Let the next meal come to follow the same thing. And that's why if you do it along with the family, the child always mimics what adults do. If the adult is eating, the child sees that and starts eating. If you alone make the child eat, the baby may not eat. I've seen mothers showing pictures, showing television, listening to music, and they get tired really sometimes.
Yes.
So I will say always 20 minutes time, 20-25 minutes maximum. After that, take out the plate, wait for the next meal time, then again do the same thing and sit with the family. Then baby will see and then start eating. Let the baby spill, let the baby make some little dirty on the table. That is still acceptable. But the child will learn the knack of sitting along with the family and sees what others do and mimics that. And once that comes, the child will start the food habits, and there will be less chances of food aversion. Nowadays, we see a lot of children not eating. My child is not eating. My child is not eating. So all this will be avoided by following this healthy food habits schedule, which should start from birth, from 6 months of age, when you start the weaning food. So that practice should come there. Again, I cannot answer the whole answer for that question, but this is the general guidelines which I've given you when you want to feed a 2-year-old child.
Very, very beautiful session, sir. It was so enlightening. I'm sure all the new mothers are very, very delighted to be a part of this conversation. Now I hand over to Tripari ji, who is the organizer and coordinator of this program. Over to you, sir.
डॉक्टर सुजय, मैंने सारी बहुत सी बातों को सुनते समय मुझे पुराने जो ट्रेडिशंस थे बच्चों को पालने वाले, बहुत सारी चीजें मुझे वो मिली, लेकिन ओवर द पीरियड ऑफ टाइम कुछ कुरीतियां भी उसमें जुड़ गई। तो जैसे 9 महीने का बच्चा होता है, 10 महीने का बच्चा होता है, उसको दांत आते हैं तो दस्त लगते ही हैं। ये एक कॉमन प्रॉब्लम देखी जाती थी। तो बाद में डॉक्टरों ने मुझे बताया कि जब दांत आते हैं तो उनके खुजली आती है और वो कुछ ना कुछ मुंह में लेकर के इन्फेक्टेड हो जाते हैं। तो इस प्रोग्राम का उद्देश्य आपको एक बहुत सामान्य जानकारी देना था। आप अपने बच्चे के लिए और खुद के लिए अपने डॉक्टर से जरूर संपर्क करते रहें। याद रखें, पुरानी परंपराओं में बहुत कुछ मिश्रण हो गया है, जिसके कारण वो उतनी लाभदायक नहीं रही हैं। तो बेहतर होगा कि आप पुरानी परंपराओं का सम्मान करते हुए आधुनिक विज्ञान का सहारा लेकर के अपने लिए एक स्वस्थ बालक को लेके आए। डॉक्टर सुजय को मैं बहुत बहुत धन्यवाद दूंगा। इस पता नहीं कोई सौभाग्य है जो आप जैसे महान डॉक्टरों से मिलने का मुझे अवसर मिलता है। और आप जैसे गाइड किए, ऐसे लगता है कि यदि सबको ये गाइडेंस मिले तो हर घर में एक स्वस्थ शिशु हो सकता है, और वो एक स्वस्थ ही 100 के बराबर होगा। तो
यस सर।
कुछ प्रश्न ऐसा आया था मेरे पास कि यदि कोई आपसे कंसल्टेंसी करना चाहे, क्योंकि आप भारत में नहीं रहते हैं, भारत से बाहर रहते हैं, तो कोई यदि आपसे कंसल्टेंसी करना चाहे तो क्या ये पॉसिबल है?
Yes, sir. They can WhatsApp me on my India number, and they can ask any questions. We can do a scheduled consultation.
हाँ, तो स्वाति, इफ यू आर देयर, प्लीज शेयर डॉक्टर सुजय's नंबर ऑन चैट बॉक्स। और सभी दर्शकों से मेरा यह अनुरोध है कि हेल्थ इज वेल्थ एक ऐसा प्रोग्राम है जिसमें हेल्थ की प्राइमरी इंफॉर्मेशन को घर घर तक पहुंचाना है। इसके लिए हमने एक हेल्थ इज वेल्थ करके एक व्हाट्सएप ग्रुप बनाया हुआ है, जिसका लिंक अभी अभी स्वाति ने शेयर किया है। आप उसको क्लिक करके ज्वाइन कर सकते हैं। डॉक्टर सुजय का नंबर भी शेयर कर दो, डॉक्टर स्वाति, सॉरी स्वाति डॉक्टर ही डॉक्टर घूम रहे मेरे दिमाग। डॉक्टर सुजय, आप इतने स्वीट कैसे, मेरा लास्ट प्रश्न ये है कि आप
Yes, sir.
स्वीट कैसे हैं, ये बताइए मुझे। मैं आप जैसे स्वीट कैसे हो सकता हूँ?
Nice, sir. I am as I am. That's all.
कोई डॉक्टर इतना डाउन टू अर्थ हो, इतना एक्सपीरियंस्ड हो, इतना लर्नेड हो, बहुत सारी खूबियों के साथ में एक व्यक्ति को देख रहा हूं, मुझे तो बहुत प्रिय है ये। और इनसे मैं डायरेक्टली बेंगलोर आश्रम में भी मिला था, और सच में इनसे मिलना एक बहुत ही सुखद अनुभव होता है मुझे। और मैं आपको कैसे धन्यवाद दूं, मेरे पास ऐसा कोई शब्द नहीं है जिससे मैं डॉक्टर सुजय को धन्यवाद दे सकूं इतने सुंदर प्रोग्राम के लिए। और उम्मीद करता हूं कि कभी भविष्य में आवश्यकता पड़ेगी तो डॉक्टर सुजय हमें जरूर समय देंगे। सर, लास्ट फ्यू लाइन्स फॉर अस, फॉर गाइडिंग अस।
I'm very grateful for your words, what you just told me. I am as it is as I am. It's all because of the grace of people like you and elders, which have come to this position of helping others in my field of pediatrics and neonatology. And my only suggestion is we all get old and we die one day, but our future generation should be very healthy. If they are healthy, they are happy. And if they are happy, the country, the world will progress in a much better way. So it's our duty to make sure we get the correct guidance how to take care of the child. I still recommend and strongly suggest to give exclusive breastfeeding for their babies when they are born. Nowadays, there are a lot of formula companies which is coming up, lot of marketing, propagation happens. Formula is all based on cow's milk. Cow's milk is more for calves, not for humans. Humans, mother's milk. So this knowledge and awareness about the importance of breast milk will play a big role for very good health for our future generation. See, we all expect our future generation should be happy and healthy. For that, this is one of the stepping stone and a very strong foundation which we should inculcate and advise the mothers for exclusive breastfeeding for their babies. And as much as possible, avoid formula milk. This is what my recommendation and request. Thank you very much for all your support.
थैंक यू सर। जैसे कि पुराने लोग कहते थे, माँ के दूध से बड़ा कोई अमृत नहीं होता।
यस सर।
आधुनिक विज्ञान भी यही बात कहती है। मैंने यहाँ पर डॉक्टर सुजय का नंबर चैट बॉक्स में डाल दिया है। आप ग्रुप में ऐड होंगे तो हम ग्रुप में भी डाल देंगे। आपकी यदि इच्छा डॉक्टर सुजय से कंसल्ट करने की है तो आपको उस नंबरों से संपर्क कर सकते हैं। मैं क्या बताऊं, इतने सुंदर प्रोग्राम हो रहे हैं कंटिन्यूअसली, और मैं इन सभी डॉक्टर्स को तहे दिल से धन्यवाद देता हूं कि कैसे आप लोग मेरी बात सुनते हैं, कैसे आप मेरी विनती को स्वीकार करते हैं और कैसे जनता को जागरूक बनाने में मेरा साथ देते हैं। ये गुरु कृपा है, ये ईश्वर कृपा है। इस प्रोग्राम के लिए भी मैं आपको बहुत बहुत धन्यवाद दूंगा। मैं धन्यवाद दूंगा अभिलाषा को, मैं धन्यवाद दूंगा स्वाति को, मैं धन्यवाद दूंगा प्रेरणा को, षणमुख को। ये लोग पूरे समय लगे रहते हैं इन प्रोग्राम्स के प्रचार प्रसार के लिए। आई थैंक ईच एंड एवरी पर्सन ऑफ दिस टीम। थैंक यू सो मच, थैंक यू सो मच डॉक्टर साहब।
थैंक यू सर।